Today I'm going to talk to you about how to communicate better with Alzheimer's patients. Esther Harima said it best when she said, "We all know that taking care of a loved one with Alzheimer's can be very challenging, especially when they begin having trouble communicating. There are many tricks to making this easier for the both of you. First, there's our verbal communication. When talking with your loved one, you should always use exact, short, and positive phrases. When asking a question, make sure that you only ask open-ended questions, something that they can say yes or no to. If you need to repeat yourself, make sure that you repeat the sentence exactly as you originally said it. Make sure that you speak slowly and clearly when communicating with them. It is important that you make sure you allow them adequate time to answer you. When you have to provide your loved one with instructions, make sure that you only give them one instruction at a time. Finish that instruction and then let them move on to another one. This gives your loved one something to focus on without getting lost in a mountain of things to do. Make sure that your voice stays calm and gentle and speak to them as an adult. When it is possible, try to use words or phrases that they are familiar with. Using these words or phrases could help jog their memory and make it a bit easier. It may seem that when we are communicating with our loved ones, we primarily use verbal communication. However, nonverbal communication is used a lot more than we realize and sometimes can be more effective in relaying a message, having more of an impact on them. Nonverbal communication is signals that we give off with our body. A few things to remember are our facial expressions, eye contact, gestures, touch, and our tone of voice. When you are talking with a loved one, always be aware of your facial expressions. Let me explain. You could be trying to encourage Aunt Sally to stay positive about a certain situation, but she may be getting mixed messages, especially if your face is hard and grimaced, and you do not look concerned. Your tone of voice and your body language need to mirror one another. Eye contact is also very necessary when trying to communicate with someone who has dementia. Making eye contact will always ensure that your loved one is looking at you and focusing on what you are trying to say. Always approach them from the front and not from the side. If you approach them from the side, you have a bigger chance of startling them and them becoming upset before you even start the conversation. Esther Harima also suggested in her article 9 tips on how to talk to someone with dementia that it is very important to remember to be on their level when talking. If they are standing, then you need to stand up so that you're eye level. If they are sitting, then you need to sit down in a chair beside them. Whatever the situation, always make sure that the both of you are on the same eye level so that direct eye contact is happening. Whether we realize it or not, our tone of voice can also influence how effectively we are communicating with someone with Alzheimer's. If we talk to them in a calm, patient manner, then they will be able to understand us better. If we become agitated because we have to keep repeating ourselves, then it will only upset the person that we are trying to communicate with. This will only end up with them shutting down and not communicating at all. We also need to pay special attention to our body language. Take a mental note of where your hands are placed, your arms crossed, how you're standing. These things could come across as something different to a person with Alzheimer's. Also remember that their body language is not a reflection of what they are trying to communicate with you. Make sure that you have gained eye contact before you touch them. Again, touching them before they realize you are there could lead them to becoming frightened. Always make them aware of your presence first. When you speak to them, call them by their name that they want to be referred to. Maybe when you knock on the door, call their name first prior to walking in. This is just an added measure to make them aware of someone else in the room. All of these are tricks that can lead to a much better outcome for the both of you. We know that taking care of loved ones with dementia can be a very stressful time and very challenging. As you go about this journey, you will definitely not remember all the things that I just mentioned. However, the most important thing to remember is to always remain calm and approach them in a relaxed state. With an approach like this that we just discussed, your loved one will know that you are only there to help them and that you're trying your best to understand needs and wants. The end result is that you need to be guiding and flexible in your communication approach when you're taking care of your loved ones.
Yay, good job. Hello, and hello,
Hello.
and hello.
Hello.